In the room, we have CT Muga Nduoko, Eric Latif, and now joining us on the line is the Governor of Mombasa County, His Excellency Ali Hassan Joho. Good morning, Governor.
Good morning, sir.
Thank you very much for joining us in this room this morning.
Thank you for calling, sir.
Now, we know there's a lot that is happening in Mombasa. Today is the day that Mombasa goes into isolation.
Yes.
You've been advocating for a total lockdown.
Yes.
Are you taking these as small measures, incremental? Are you taking this and saying, okay, good enough, let's move on?
Yes, we are taking the measures put in place positively. I think it may be a good beginning. And obviously, the battle on COVID-19, we have to progressively evaluate the situation and be able to take more measures. So this is one, and we're looking forward to further evaluating and seeing what else we can do to ensure we put measures that are effective, really.
Yesterday we had callers calling and wondering how they were going to get affected by this. Some of the people who work in Mombasa, but they live in Kilifi and Kwale. And they're wondering, so what's the fate of us? What's the fate of our jobs and the rest?
This is the point, my brother. People must understand that it's not going to be easy. It's going to be tough. There's going to be a lot of sacrifice that each one of us have to undertake. And these are the things that we'll have to go through. Stay at home when we don't want to, not necessarily be able to report to work. And that is why the government at the national level and the county level is having a conversation on how we'll be able to cushion these people that have had to go through this economically, so that the only way we'll succeed with this battle or against the pandemic is to stay at home, to avoid spreading it by going around easily, because that's the only way you can spread it. If we continue to go around like we normally do, then that means we're spreading it. So it may be tough, it may be difficult, but really this situation has to be managed in that manner.
Governor Joho, do you see that it is necessary then to suffer a little bit? And when we talk about suffering, those individuals who say, well, I need to go out and make a little something every day to eat, is it necessary to suffer in the interim to then get the result at the end of the day whereby we can then catch up?
This is the time to suffer a little bit. This is the time to sacrifice. This is the time to stand up for one another. This is the time to be on the lookout to help those that need help. And that is my call. I have been telling people, you be on your brother's keeper today. You look after your neighbor if you have to. Because all of us have to suffer. And if we took that decision that let's sacrifice a month, suffer for just probably 14, 21 days or thereabout a month, the narrative will change. We will turn this around, because right now, whether we like it or not, the graph is on upward trend. We need to tilt it and bring it down. And it just won't happen. It just won't happen on its own. It requires a bit of sacrifice from all of us.
There appears to be a lot of naysayers in your county, Governor. Very many people who call on this show say, well, this COVID-19 story, just forget about it. We need to live our lives. We saw the results that were shown in a poll that was conducted the other day, that Mombasa County had one of the lowest numbers of people who are saying we support our call for lockdown.
Let me tell you, people slowly are understanding how grave these issues are. We don't want to be in a situation. The fact is that we don't have the human resource capacity, the medical equipment, and the preparedness like other cities have had. You look at Italy, for example. It has one of the best health systems in the world. And today they're crying. They're losing 700, 800 lives a day. They're at a point where they're even saying they don't know what to do. So we must be able to say we have learned from the mistakes that were done elsewhere, and we do things differently. And for me, as a leader, this is not time for populist statements. This is the time to really stand up and say, you know what, this has to be done. So we understand there, like for example in Mombasa, we've been mapping out the families that we know are vulnerable.
Yep.
And as a government, we're trying to put up measures collectively, corporate players and every national government, multi-agency, to try and cushion them. Now we're having conversations with institutions, employers, tell them, you know what, we need each other at this point. So for me, obviously we'll have to suffer a little bit, but if we took that decision, but let us suffer for like 2-3 weeks or so, then thereafter, the narrative will change. Yeah, absolutely.
You've talked about mapping out the vulnerable families. How many do you have so far in your records?
What we have mapped is 227,404 families. But we continue to verify the numbers. We continue to have our people on the ground.
These are very huge number. So how many people in total? Because these are 227,000 families.
Average of 5 people per household, maybe.
So over 1 million people.
Yeah, that's what we're looking at. So our effort is to be able to provide the basics, water, basic medication, food for just about a month. Just about a month, and let's see how it's going to go forward.
Right.
So, yeah, so you're absolutely right to say that we need to suffer a little bit. For example, in Mombasa, we have seen the trend. We tested roughly about 240 people. 203, we got the results, of which 17 were positive. We've already lost 3 fatality cases. 3 people have died. So if you were to calculate that, 17-3, that means almost 18%.
Yep.
So number of cases that we have tested are not, for me, are not convincing. It's not a sample where we should be able to say we're on the right track.
Right.
We need to start saying we have tested 20,000 people or 1,000 people per day. That should be able to enable us to say we have the actual figures and facts on the ground, because we don't know the situation. For example, the 4 cases that we're picking from Kenya Ports Authority, these are local transmission. These are people who live in the community.
Right.
We've had a mother who passed it on to the child, or the child passed on to the mother. We're not so sure.
Yeah.
We have someone who unfortunately passed on, who passed it to the wife, and then the entire community around there are now in isolation. Some were contact tracing. So the numbers are big. And we can only determine when we get to do mass testing.
Now, Governor Joho, just understanding that this measure of mass testing that is now being recommended is coming from the premise that we don't know. So a lot of suggestions have come about for lockdown because of the fact that we don't know. It's better than to keep people in one place so that we stop it from spreading. Would you advocate for the same?
That's the whole point. Because, you see, initially I started saying that before we do anything, we should consider lockdown because of the capacity. I understand it was not easy to get PPEs. Yep. It was not easy even to, like, for example, in Mombasa, we now installed the Roche test CPR machine. And we have got another one donated to us by Washington University. But we have been struggling to get reagents. Now is when we're getting probably about 2,000-3,000. We had wanted to be in a position where we stand at the ferry and test almost everybody that crossed the channel. But we don't have that capacity yet.
To do that.
We don't have that capacity yet. So even if we were to execute our plan, which is on track, in Mombasa we have capacity to test probably about 700 a day. Even that 700, in my opinion, is not enough.
It's still not enough.
Still not enough. So if we were to do it with Cambry, probably, maybe we can push it to 1,000, 2,000 a day. We have countries or cities that are doing 10,000 cities a day.
A day.
Yeah.
And you see, only when you test your people, you'll be able to be informed the actual position on the ground. But situation as it were, really, we're just not so sure. The numbers that we've tested are not sufficient to be able to tell us we're doing well or not.
Mm-hmm.
So for me, really, lockdown should have been the situation, even though I understand when people say there are serious economic issues, people need to be consulted. Besides food, people are paying mortgages and what have you. That is why I'm saying every institution, government, and
all should work together.
We need at this point to work together. The only way we'll be able to succeed is when we work together. And every one of us sacrifice up to some level to say, this is my contribution towards the fight against this pandemic. Otherwise, we'll not really have a positive story to tell.
Excellency.
Yes, sir.
Naomba nikuulize swali kwa Kiswahili ili wenzetu ambao wako Mombasa labda waelewe zaidi.
Siku hizi wajua kizungu kweli watu Mombasa, lakini niulize.
Nice one.
Basi nitakuuliza kwa Kiingereza basi.
Haina neno Kiswahili pia ni sawa, watu waelewe, wengine ambaye waelewi.
Asante. Within the next 2 weeks, I believe the holy month of Ramadan will begin.
Yes.
Now, nilikuwa nataka kuuliza ni mipango gani serikali yako iko nayo kuhakikisha kwamba wenzetu ambao watakuwa wanatimiza masharti ya mwezi huu tuseme maslahi yao yameangaliwa.
Ndugu yangu, mimi nimesema, unajua sisi hapa Mombasa, Waislamu wengi, they've always every Ramadan had a program of feeding people. I know of a family, for example, that feeds 22,000 families during Ramadan. My humble appeal to everybody that today is about humanity. Today is not necessarily about a faith or specific faith.
Yep.
We want to make sure, Ramadan or not Ramadan, that every family in Mombasa, literally every family in Mombasa, wana msaada, watapata msaada. So, tunataka tuiangalie broadly kwamba kila jamii, Muislamu, si Muislamu, Hindu, whatever it is, ambaye anahitaji msaada apate bila kukosa. Na tutambua sisi Ramadhani itafika, na Ramadhani ensure ile program ambayo tunafanyia kila mtu, pia Muislamu apate during Ramadan. So I am kind of grateful to those families ambayo kawaida wanapeana chakula Ramadhan. Huu wamekubaliana tuungane mkono tupeane chakula sasa kwa kila mtu, Muislamu, sio Muislamu, ambaye faith ile ama faith ili watu wote wasilale njaa.
Governor, you've started a program to mobilize these resources. You've already been able to raise some money. How much have you raised so far? Is it close to 20 million?
20 million. We are county 001, my friend. We have a lot of philanthropists, who are generous. People are committed to helping each other, which I'm really grateful about. By today is Wednesday.
Yes.
Yeah.
By Monday, we're almost reaching 100 million shillings.
Okay.
That's good. That's very good. What target do you have?
Our target is food worth 700 million. This is our plan.
Okay.
The county government is contributing 200 million of food.
Yep.
Obviously, we're asking national government to step in.
Right.
We're hoping maybe we can get 300-400, whatever it is.
Okay.
And then the shortfall or the deficit is where now the private sector is coming in.
Would come in.
Yeah.
The question, though, Governor, is that how were you able to do this? I mean, we're seeing the barns where food is already being put aside in the event that it is needed, which is coming, right? We've seen other things at the ferry, the sanitation port that you're putting up there and making sure that people are sanitized at all. We saw the taps that are being put in place. We've seen this, and obviously it's not just a fly off the seat of your pants action. It's something that was planned. How are you able to do this?
Let me tell you, first thing that you do as a leader is to bring everybody on the table, bring everybody on board. form a united front from across the spectrum. If it is business leaders, political leaders, corporate leaders,
religious,
civil society, the clergy, the religious leaders, what I did first is to bring everybody onto the table. Say that we are in this situation. The only thing that will save us is to stand together.
Yep.
So, and my county commissioner, which we co-chair the committee, is also very efficient and effective. So it was easier to say that watu wamekubaliana, we will come together, we'll leave our affiliations outside there, mapenzi yetu, chuki zetu nje, tufanye tu sasa kwa umoja, ili kuweza kutumikia watu. And that for me is the success story. Because immediately, for example, when we wanted to do the water station at the port, at the ferry, immediately we had a solution because we had someone with a tank who had mobilized it, and then someone with the drilling machine, ambaye amesema ndio hiyo, the rig, the water rig. So we were able to do an efficient borehole system within 24 hours. So we did 2 effective and efficient supply of water within 24 hours, point mbili.
So without COVID, these things can happen. Even if COVID was not there, the county could be running efficiently, properly, isn't it?
We were having a conversation yesterday. Na tunasema Mungu analeta kitu na mtihani, lakini pia sometimes iko na baraka zake. There are lessons that we have learned.
Absolutely.
There are lessons that we have learned as leaders, as business people, and maybe going forward, kutoka hapa tutajifunza kwamba umoja wetu utafanya mabadiliko makubwa. Kwa mfano mimi nakwambia sahihi Mombasa, the good gesture. You have people walking in. Mtu anakuja na mahindi nusu kilo, anasema this is my contribution.
Wow.
Somebody even bringing water, somebody buys a carton of mineral water, said this is my contribution. So people are committed and there's a lot of goodwill. Ni sisi tu sometimes kama viongozi nafikiri tunajisahau sisi ni nini
na siasa.
But we indeed can pull this country together. We can. Look at the situation today. Tunaongea lugha moja, tunaelewana. I have brought my opponents on the table. Wale watu walinipinga kwa jadi, nikamwambia this is now your time to contribute towards a good cause. And everybody is responding well. Really. So there's positive response. Watu wamejitolea, ni sisi tu kama viongozi kujipanga. Kwa mfano, unajua sisi we are working on building capacity. We are saying, I told the private hospitals in Mombasa, we must build a fully equipped hospital outside our normal operations only to deal with COVID-19. So nimemwambia sisi tutasacrifice kama county. Na nyinyi private hospitals, mutoe contribution on equipment and human resource. So we do it collectively.
Right.
So tukipata patient, tunapeleka a COVID hospital. This is how other cities succeeded. Ukipeleka, for example, we're looking at Technical University of Mombasa, turning it into a 500-bed hospital. Alafu, tunataka to create some 50 ICU care beds and facilities at the Coast General. So, tukikupeleka pale when you need intensive care is when now we move you to Coast General. So meaning we have to coordinate with private sector hospitals, CC ambulances, ICU ambulances, so that we try and truly isolate COVID patients in one hospital, that we can look after them.
And we can deal with them.
And we can deal with them in one place. There are cases in Mombasa where 18 nurses had to go into isolation or self-quarantine because of dealing with one patient. So if we're not careful, we'll end up having a big number of our medical staff self-quarantining or in isolation.
Right.
Because you cannot do that. Now, let me ask, the idea that you've raised, and it sounds like a very good idea, turning Technical University of Mombasa into one huge facility, 500-bed capacity. What else would be required? How many doctors would you need for that? How many nurses? How many medical workers? What else do you need to get that moving?
you see, first of all, the good thing is that we're asking the hospitals, sisi wenyewe, we're asking the private hospitals, maybe if we closed a few of our wings, move the equipment, because I see, for example, like Mombasa Hospital has had a wing COVID-19.
Yep.
Aga Khan, they've had a wing. We have a wing COVID-19. We all move it there first to start with.
Mm-hmm.
And then the human resource, wale na wetu na nani, we move them to that point.
Mm-hmm.
Number one. And then we shall be able to evaluate what do we need. But we're roughly looking at an average of 20%, for example, ventilator support.
Yes.
We need to pipe the oxygen, which we're ready because we already have the stock in the Coast General Hospital.
Mm-hmm.
The basic medication that we produced, we have recently invested 124 million in equipment, new equipment that has arrived, ambayo sasa tukicombine na hiyo ya hospitali za kibinafsi itakuwa ya tosha. We have advertised for 100 new staff for health. We are evaluating if we need more. Like I said yesterday, as a county we are ready to shelve a lot of our projects. Lakini huwezi kukosa nurse, kukosa daktari, kukosa matibabu at this point.
Yeah.
So if we are to say tuongeze number ya madaktari kwa 300, we shall do it.
You'll be able to do that.
We've even created a database. Hata wale madaktari ambao waliretire tumejua wako wapi sasa. Na tumeongea nao, tumesema the day we need you we'll give you a call.
So they're on standby.
They're all on standby.
Okay.
They all are on standby.
A great deal of the economy of Mombasa was very dependent on what I may refer to as the maritime commerce activities at the port, CFSs and so forth. Now this has diminished. How is this going to affect the efforts that you are putting in place?
You know, we are coming up with specific plans on stimulating our economy. So we have an economic stimulus plan going forward. We'd even started looking at creating or diversifying biashara za Mombasa. You know, we have broadly the conversation on the blue economy. Lakini sahi tunasema tukishamaliza COVID-19, as we discuss COVID-19 and how we can battle it out, we're having our economic experts sitting down to draft a plan that will get us to revamp our economy immediately thereafter. So even as a county, tunasema sisi tutatafuta pesa pia tupatie watu za biashara. We're bringing financial institutions together. We're creating land for opportunities. We're now investing mambo ya uvuvi na kadhalika na kufungua special economic zone. You know, wacha ile national government ya county. We're saying to national government, gazette this one, because this one will happen immediately.
Yeah.
So like the Dongo Kundu one, which has not.
Dongo Kundu will take some time, but we have land in Mediterranean that we want to do it today.
Right.
So tukimaliza to COVID-19, we embark on creating our special economic zone, kupatia SMEs pesa za kujirudisha pale walikosea, kupata biashara tena na kuanzisha maisha. So we have an economic stimulus plan that we have. We're looking at the incentives, even at our level. Tutapunguzia watu mzigo vipi wa kodi za kiserikali. We'll negotiate for them kodi za maisha. So that watu for the next 6 months wajipange warudi back on track. Yeah.
Governor, we heard you, watched you actually in an interview the other day, and you were talking about the measures that are going to go into effect today. One of them is so that you isolate the county, was the stopping of the ferry services at Likoni. What's the position?
Let me tell you. You see, we went to the ferry and we looked at the situation, and we understand watu wanavuka kila siku. And that's why we said we could not abruptly stop the ferry operations. But what we needed to do is to try and create a safe environment for them. And we started by, you know, nilienda nikasema focus for now, because you know the ferry crosses sometimes 30,000 people in an hour.
Yeah.
Yani hii ferry, the numbers are unprecedented. You can't see these numbers elsewhere. So we tried, we prepared as we could be at that moment. watu wasimame hivi, watu wende hivi. Now every day we are looking at how best we can solve the ferry, but eventually ferry itabidi tu tujipange, kwa sababu we have 3 kilometers of people queuing every day. 3 kilometers of a queue.
Waiting to cross over on the ferry.
That's the whole point. This morning I got a call from someone who says, mimi niko hapa na gari kuanzia saa 1 na mbona ningoje saa 5. Nikamwambia unfortunately utangoja paka saa 5 kwa sababu saa hii inahitaji tu kila mtu ajitolee.
Yeah.
Ili mwananchi avuke. Na unajua sasa we're getting people to stand on the ferry 1 meter distance.
Yeah.
But now we're not managing that on the queues. We're not. Now we've done those disinfectants at the ferry. We are producing 1.2 million masks. That we want to distribute in Mombasa. You know, face masks that we are together with. We bought some equipment in the county. We are with the EPZs. We told them we need to, now this is your moment to help. They're producing them.
Okay.
So kuanzia leo ama kesho we'll be giving them out for free, and everybody must wear
the mask.
Okay.
Absolutely. Huwezi ingia mahali hata when we're ready, even government institutions, everywhere you enter you must be wearing a mask. And we're going to give it to you for free so that you don't give us an excuse that huwezi nunua, tutakupatia bure.
Excellency, so that it doesn't go unsaid, hongera kwako. This is a sterling effort that you have made, and it is life-changing. And even more so when you consider that for the longest time, a great deal of the economy of Mombasa was very much dependent on the tourism business. What you're doing will clearly indicate that you are determined in this fight, and actually you are determined in this fight. Nilikuwa nataka tu nikueleze kwamba hongera kwako.
Nashukuru bana, mimi naomba tu tusaidiane, hata nyinyi bana. You know, you guys, your voices zinasikika pahali pakubwa. Please let us continue working together to ensure we succeed in this one. And then everything else itarudi kuwa tu sawa. Because today is about life, really.
It is about life. And I know we're probably coming around to the end of this, but Governor, one specific thing that those mothers for maternal health care, for example, with a curfew already in place, and somebody might have an emergency at night, what is in place in Mombasa for those emergency services that may be required? Because it's a question that has come up. Quite a number of people are looking for those answers.
That's I got a call yesterday from some leader somewhere who asked me the same question. This is the point. First of all, that's like amongst the essential services and movement that is allowed under curfew, that is one. 2, we are now redirecting all our ambulances to 24 U's, and we're stationing them in the sub-counties. So that everybody that needs service, and we have county-colored inspector vehicles in all the sub-counties. We are telling our people, when you need help, go to that vehicle. It will help you. It will take you to a point where you need to go.
Okay.
So, wazazi wetu tunajua wengi wanapata shida, but when you see a county vehicle, it's now on the ground for that purpose.
Okay.
Yeah.
So you've basically redirected all the county vehicles to these operations.
My county vehicles are direct. They are aware that if they see a sick patient, mtu nataka kuenda kuzaa na kitu chochote, you will be the one transporting them to the facilities. They know it.
Okay.
Yes.
Ali Hassan, Joho, Governor of Mombasa County, we thank you very much for speaking to us this morning.
Asante sana ndugu yangu.
Very many of your constituents are listening to you this morning. Just one final word. Speak to them directly.
I just want to plead with them that COVID-19 is a reality. Tusifanye makosa kufikiria kwamba sisi haizi tushika. Inaweza kushika kila mtu. The only thing that we need to do to be able to succeed ni kujilinda, kujichunga na kupunguza matembezi yetu, not to move unnecessarily. Please stay at home. Kama huna kitu cha kufanya, hakuna stories za kutoka kwenda kubangaiza. Take care of yourself. Take care of your family. Na kama huyapendi, yafanyie wale ambao unawapenda. ama yafanyie wale ambao wanakupenda. If you don't want to do it for yourself, do it for the people you love.
Absolutely.
Or at least also do it for the people that love you.
That love you, absolutely.
Indeed.
Yes.
Any enforcement measures that you have in place to ensure that people are observing this? Because, well, there are those that will flout and
You
they
know,
just
the
need to be
point is-
reminded.
One point is we have really advocated against police brutality. We have said no cases in Mombasa, and I'm grateful after the ferry incident. We have never had another issue. But the point is, we're telling our people, abide by the regulations. Just understand that this is for you. And that is the message we want to send. That we will not get to a point where we have to use force to get you to go back home. We want to get to a point where everybody understands that they need to be at home. So we will continue passing on the message. We depend on you as well to pass on the message.
Yep.
This really has been done for the good of all of us.
Before we let you go,
So
Governor.
that we don't get to a point where we have to see inatwanga nini rungu.
Yeah.
Yeah.
We really don't want that.
Nataka kuona
We
nyahunyo.
don't. And here, we don't want to see that really.
Before we let you go, Governor, we always have a proverb of the day. And today's proverb, I think, will speak directly to you. Siti Muga, tell him.
It is the crooked wood that shows the best sculpture.
Umeelewa?
The crooked wood that shows the best sculpture. Wonderful.
Yes.
In this particular case, what we are facing is a crooked wood.
Uh-huh.
And the one that is able to work with this crooked wood
It's going to come out.
and
the
actually
best.
produce a very good sculpture will be the best sculptor.
Absolutely, in agreement. I'm in agreement.
And in this particular case, Governor, I think you're already demonstrating that you're heading towards being one of those that will emerge.
Nashukuru ndugu zangu sana.
Congratulations and all the best. All the best with all the work that you're doing.
Please remember to stay safe.
Yes, for sure. Thanks so much. Thanks so much, Governor.
Thank you very much, Governor.
Stay blessed. Stay blessed always. Thank you.
Asante.